So if we're not just diagnosing rebellion anymore, if we're not sending teenage girls to therapists to be fixed, what are we doing? What does modern adolescent mental health support actually look like when it's done right? Let me paint you a picture, okay? Because I think it's important to not just tear down the old model, but to show you what the new one looks like in practice. Modern therapy for adolescents isn't about convincing a teen to comply. It's about creating a safe, non-judgmental space where a young person feels heard and empowered to find their own solutions. That's not a slogan. That's a clinical framework. And every word of it is intentional. Safe. The physical and emotional environment matters. A good adolescent therapist creates a space where a teenager knows and truly knows that what they say won't be weaponized against them. That includes navigating the tricky boundaries of confidentiality with parents. A skilled therapist will be transparent. Here's what I'm required to share with your parents. Safety concerns, things like that. Everything else, this is your space. Non-judgmental. This is where the 1953 model falls apart completely. You cannot help someone while simultaneously judging them. You can't. The therapeutic relationship requires unconditional positive regard. A concept from Carl Rogers that is foundational to modern counseling. It doesn't mean you approve of everything the teen does. It means you accept them as a whole person worthy of respect, regardless of their behavior. That acceptance is what allows them to let your guard down and actually engage in the work. Hurt. For a lot of teenagers, especially ones who have been labeled rebellious or difficult, the experience of being genuinely listened to is revolutionary. They used to be talked at, lectured, corrected, dismissed. When someone sits across from them and says, "Tell me what this is like for you, I actually want to know," and actually means it, something does shift. Often that's the moment therapy starts working. Not when the therapist deploys some brilliant intervention, just when the kid realizes something is actually listening. Someone is actually listening. Empowered to find their own solutions. This is the part that would have absolutely horrified the 1953 authors, because the modern approach explicitly centers the teen's agency. We're not telling them what to do. We're helping them develop the skills, the self-awareness, and the confidence to figure it out themselves. That's not permissiveness. That's skill building. We're teaching them to fish, not handing them the fish. And definitely not telling them they're wicked for being hungry. And you know what happens when you treat teenagers this way? When you respect their autonomy, create safe spaces for them, and empower them to be active participants in their own growth, they show up, they engage, they do the work, they develop emotional intelligence, resilience, communication skills, self-advocacy. All the things we actually want for them. Not because they were forced to, because they were invited to. Because someone treated them like a person instead of a problem. The outcomes aren't even close. Evidence-based, autonomy, supportive approaches to adolescent mental health produce better therapeutic engagement and retention, improved family communications, reduced behavioral issues, not through suppression, but through genuine growth, higher self-esteem and self-efficiency, lower rates of anxiety and depression, better long-term mental health outcomes into adulthood, and stronger parent-child relationships.